Right, guys, today we're talking about hips and whether you have a hip stability deficit or a hip mobility deficit. You're going to treat them two very different ways, and so we've got Jason here today showing us kind of the difference between the two and how I test it in the clinic. So let's drop this one through here. So I'm going to measure kind of where his hip rotation is, and when we're looking here, if we get to right about there, his pelvis starts to move. So that's the limit of his hip mobility in this position, and that's not horrible, but there's definitely some room for improvement. But I want to look a little bit further. So if we take this, Jason, bring that up towards your chest, just hang on tight to that for me, and then do your best to relax this leg out. If we change that and we bring that up through here, we see that that pelvis opens up a significant amount. And so this is the type of person that does not necessarily, you can bring that back down, that does not necessarily have a hip mobility deficit. It looks like their hips are stiff, but really what we're looking at when we bring that knee towards your chest is we're changing your pelvic position. And so this person has a pelvic position deficit leading to the illusion of a stiff hip. And so this is not the person that's going to do well with hip stretching, and what they really need to do is focus on getting that pelvis more stable, maybe some oblique core training. So if you guys have questions about that, or if you think this might be you, try this little self-test at home. Bring your knee towards your chest, test the motion with the knee up versus the knee down. Does it change significantly? If it does, we're probably looking at more of a pelvic stability issue. If it doesn't, you're probably looking at more of a hip mobility issue in which that stretching and stuff might actually help. So if you have questions, definitely comment below. We'll answer them. We'll get back to you. All right, so in order to correct this more of a pelvic stability deficit, we're going to look to some sort of oblique activation. I'm going to have Jason do some what we call balloon breathing today. It's a great way to activate it. There are lots of different ways to do this, but this is one that's kind of good bang for your buck. If you want to learn more about it, I wrote a book on it. You can definitely check the link below for that as well. But Jason, we're going to breathe in through your nose. You're going to blow into the balloon. We're going to blow all your air into that balloon. What we're looking for here is as he's blowing, keep going, keep going, keep going. We've got these ribs activated. They're dropping down. We're going to hold for 2, 1. Keep the air here. Breathe in through your nose. He's squeezing on this ball just a little bit. We're breathing out again. Good. And that's probably good there. Pause. 2. You can take it out. Let all the air out. Okay. And I'll probably maybe do one more cycle of that, those 2 breaths. You got good lung control, sir. And so what we're doing here is he's forcibly exhaling. We're actually asking him to activate his obliques, which will help correct that pelvic position. We're also activating the inner thigh, which will help decrease the tension in the outer thigh and will help correct that pelvic position as well. And you can just let that go. So let's take a peek now after we've done that. We'll go ahead and drop this down through here. We bring that up. You're going to do your best to relax here. And if we bring that out through there, we get a significant difference on it. And all we did was activate his core kind of stabilizers and change the way his pelvic sits relative to the table. So this might be something I give him to work on at home. This is, again, not a person that's going to respond well to stretching their hips. We need to stabilize other body parts. So take it, try it. If you want to check out the book, you certainly can.